Thank you so much. And as my colleagues mic up, can I request if I can have the online participants, if I can see Yeshu and Nishant and Vanshica are there online? It's pretty late for them, and I think I can start from them. Thank you so much, Yeshu, Nishant, and Vanshica for joining. Yeshu, Nishant, Vanshica, we had a fantastic session just before this. We were talking about coordination efforts, how MDBs, philanthropies, technical organization, countries, CSOs, advocacy groups need to come together. One example which came out in the last session, I think you heard Tamer saying about the Indonesia MDBs coming together and financing about $4 billion US for Indonesia. So please meet here Yeshu, the project officer from ADB, who actually made this happen along with Dodo. Can I request you for a big hand for her, please? This is a $4 billion financing for Indonesia. And this also had a huge climate financing. So maybe Yeshu, she's a senior health specialist based at Indonesia. And if I can request you to take us through the journey which happened and how this is going to change or transform the health sector in Indonesia. Over to you, Yeshu. Thank you.
Thank you so much, Dinesh, and good morning, everyone. It's a pleasure to join this session today to share a little bit about what we're doing in Indonesia. I would say that, ADB has really started working on climate change adaptation and mitigation quite early on. Since 2015, actually, we are already implementing technical assistance projects focusing on the health sector. How can we help the health sector adapt to the potential negative impacts of climate change? And we started in the GMS region, the Greater Mekong sub-region. I have been placed in Indonesia since 2023. And as Dinesh mentioned, we are supporting the government of Indonesia implementing a really, really ambitious health sector transformation agenda, in which the climate change mitigation and adaptation is at the very forefront. So we collaborate with the government on several different areas. For example, we start with advocacy and awareness raising and joint evidence and joint knowledge generation to support the advocacy and awareness raising. So for this, we are leveraging on the climate and health initiative that was led by Dinesh, and it is now a $10 million mega technical assistance project. With that resource, we were able to collaborate with the Directorate of Environment and Health in doing health sector decarbonization assessment and mapping. We're also helping them to develop not only the national adaptation plan, but also regional action plans. And we're also helping them with specific tools that they can use as a playbook of solutions that we can incorporate into our projects. I think in the previous session, Dinesh also mentioned that ADB will continue our health system strengthening approach while mainstreaming climate change mitigation and adaptation solutions in all our health sector projects. So I think that's the first part, which is knowledge work and evidence generation and advocacy. And we do this with our partners as well. So, for example, we work with the World Bank to develop studies that are about environmental health, particularly in terms of the supporting the Partnership for a Lead-Free Future. We're working together to assess the blood lead level among vulnerable children in Indonesia. And we're also collaborating with the Rockefeller Foundation on a very new program to support the government school meals delivery program to tackle the complex challenges of food insecurity due to climate change that result in poor nutrition, health and education outcomes, and in general, greater vulnerability. So this is a cross-sectoral effort within ADB and also within the government to try to bring innovative but also context-specific solutions to the country. So the second part about the joint financing, Dinesh also already mentioned the 4 billion investment project that the government has requested from not only ADB but also World Bank, AIIB, and ISDB. So we have really accumulated great experience in this collaboration since 2023. So I think here, really the key is a government-led process and full cooperation among all the development partners in order to maximize the impact of investment and also to really improve the efficiency of project implementation. So under this project, the $4 billion will support the procurement of essential medical equipment in all of the primary healthcare facilities, referral hospitals, and public health laboratories nationwide. And all of the procurement of these equipment will follow green procurement principles. We have strict requirements on energy efficiency of these equipments, and also, in connection with the other technical assistance on climate mitigation, we are strengthening the capacity of health human resource in dealing with climate-sensitive diseases and disaster response in general related to climate change. So I think I'll stop there. Thank you very much for the opportunity.
Well, thank you so much, Yeshu, for telling us about the Indonesia project and the climate financing. Please stay back because I'm going to ask you the two questions later on. One, of course, on your green biolabs, which you are thinking with the regulator. And second, on, I think you have heard about Wolbachia bacteria. So to take up your mind and thoughts on the same. Let me also please welcome Mehereen, June, and Avdesh also on the stage. But let me first go to Nishant. Now, Nishant is a health financing guru who has taught health financing to many of them in different parts of the world. But today he's here because he's doing something very special. Under guidance of Dodo, he is working on a project in Thailand. So Thailand normally does not borrow, but is borrowing or planning to borrow from ADB for a climate smart infrastructure hospitals. Now, this is the power of an idea. This is the power of a lead which a bank has taken on climate and health. And countries like Thailand are also saying, hey, how do we invest on climate and health in infrastructure? Nishant has also worked on infrastructure in medical colleges upgradation in India from ADB. So maybe Nishant, our senior health specialist, thank you so much. He's joining from Manila. It's about 11 p.m. in the night, if I'm not wrong. But thank you so much, Nishant, and the floor is yours.
Thanks, Dinesh, and good morning, everybody, and good afternoon, good evening to people who have joined online. It's a pleasure to be here. And yes, it's around 10:30 in Manila, but seeing so many people there online, of course, I feel very energetic. So as Dinesh said that, I will just share briefly about two things we are doing in India and Thailand. So as Ye was also mentioning earlier, this topic of climate change and its impact on health is nothing new. It's something which we as ADB are trying to take it very seriously from almost a decade. But at the same time, I think the pace has increased in the last, I will say, 4 or 5 years, and rightly so. And COVID had shown that how the world is so much interconnected now that if we don't take care of these issues at this stage, it can become much, much bigger problem later on. So, for example, in India, when we started working with the government and when we received the request for building some new medical colleges and teaching hospitals, we realized that there are two issues to that, even when we link to climate change. One is that when you build your infrastructure and equipments and related things, of course, you need to think about climate adaptation and mitigation strategies. But at the same time, these are operational issues. you have to also see from the policy perspective that do we have policy level recommendations and decisions being taken which can have a larger impact beyond the few sites where we will fund. And that is where I think what we worked with the government, that we decided to have some kind of modality where we have policy component and investment component both. So the policy component helped us. For example, one of the important policy which we came out along with the government was on asset management. So it was climate resilient asset management policy, where for the first time in India, in medical education and health sector, we had an asset management policy, which means that every physical asset which is created, whether it's infrastructure, whether it's equipment, or whether even it's IT assets, all these assets, actually you have a policy, you can actually see which was built when, what are the qualities there, when it needs renovation, when it needs the next level. So I think that all these things were brought together, and on the click of a button, you can see through a dashboard that what is the existing structure, existing situation regarding each of the assets. And that is where actually it will help you to manage them in a much more efficient way. And you can actually do things proactively rather than waiting for it, for example, to break down, or rather than waiting for it to become much worse. So this was something which has huge implications. Similarly, we had so many IT software being run in health sector, and there was a lot of there in India also, which are being run in parallel to each other, or which are sometimes even doing duplicate work. Sometimes it's a fragmented system because it's a legacy system like in many other countries. And one policy which we came out with is a comprehensive information technology policy for health, which means that then we said that, okay, all the different pieces will have to fit together. They have to come from us from a perspective that they all talk to each other. And that does not mean that you discard the legacy system. That means that you create bridges. Wherever the systems are there and working well, you create bridges so that you start talking to each other. Wherever there is nothing, you build something, but you try to actually make this all small pieces part of a larger picture. And that is what which was very important. So from the policy perspective, I think we did some of these things. We also had a policy of setting up a center of excellence, where a lot of climate change and health related research is being carried out. And that is something which is, again, the idea is that for the next few years, this will be one of the main important topic for research and training of the staff. So these are the things which came out from the policy perspective. At the same time, from the investment perspective, we realize that when you're making these buildings, what all new technologies which are there, which can be brought in, which can help towards climate adaptation and mitigation. And that's where actually we try to bring a lot of new technologies, a lot of new ways to reduce waste, to a lot of new ways to actually have less impact, harmful impact on the climate. And a lot of work was done in terms of studying new things which are available, but also see how do you adapt in a country like India. So all these things actually helped us not only to do to make these facilities which are being built better, but also to show the government that, in future, even if they are building new facilities with their own funds, some of these good practices can be used by them and by other states also beyond that particular project where we are working. So similarly, what Dinesh mentioned about Thailand, I think there again, we know Thailand has done great work in health sector. A lot of countries in the region and across look towards Thailand to learn from how they have revolutionized the whole universal health coverage, what they have done, the way they are able to provide healthcare at a much lesser cost. But at the same time, on the issue of climate change and health, I think we were able to work with them to find ways that how we can make the health system more climate resilient in the country. And that's where we are working with them on building hospitals across the country outside the main capital region, because in the main capital region you have a lot of things, but when you go to provinces, how do you strengthen it further? And that's where we are working with them. But just making another building is something which you can do from any money, but what is the value addition which ADB as a development bank can make? And that's where I think what we try to do is try to bring a lot of new elements in terms of when we are making these buildings. And at the same time, the idea is that these 5 hospitals will act as a hub for the nearby hospital in the provinces, so that it's not only that they are doing climate related work for themselves, but they will then also be able to help others in the nearby provinces and the nearby region, so that all of those hospitals can actually become much more climate resilient, and they adopt new practices related to adaptation and mitigation. And we also talk about, for example, retrofitting of existing hospitals to make them climate resilient. So there are a lot of these things which are being done in these two projects. I'll stop here. Over back to you, Dinesh. Thank you.
Well, thank you, Nishant and Jay. So the point I wanted to drill in the initial session was climate and health is not a vacuum. It's doing the work of health through the climatic lens, and that's where it makes it so important and so reasonable and so optimum. We have with us also Vanshica. Vanshica, I will request you to come a little later. Let me go to my participants who are here on the ground. Mehereen, Pakistan will be the showcase of this introduction here. We want to see what Pakistan is aiming at in climate and health in next 2 to 3 years, 4 years, and how, as a bank, as an ADB, we can support you.
Okay, thank you.
I think, Mehereen, you have some slides?
Yes, I do have some slides.
Can we have Mehereen's slide? Till the Mehereen slide come forward, can I ask Ruiz something?
Yes.
Ray, Philippines, you work with the Department of Philippines here, and I think there is a great strategy to have facilities climate resilient. Can you share something about that, please? Thank you.
Actually, sir, I have also slides, but to answer the questions on that. So I think first, I have the questions that we in the Philippines, where are we now? So the Philippines remains at risk in terms of the climate emergencies and disasters, and is currently at the top position of the World Risk Index report, which measures vulnerability and exposure to the natural extreme events. Being also the member of the Alliance for Transformative Action on Climate Change and Health, the Philippines Department of Health recently established the Health and Climate Change Office. We are able to launch the Philippine Roadmap on Health and Climate Change 2025-2050 that will be capitalizing on our smarter approach. This also includes that we will optimize the roadmap to fully realize our contributions on the national, regional, and global levels in terms of building climate resilient, low carbon, and sustainable health systems. Also, just to highlight that the Philippines recently host the 7th Global Ministerial Summit on Patient Safety last April 3 to 4, 2025, and issued the Mandaluyong Declaration on Patient Safety emerged as a significant outcome. Provided in the declaration is to integrate patient safety into disasters and emergencies preparedness and climate resilience. And with this, I think Philippines also would like to highlight that through the Philippines Universal Healthcare Act, envisions an equitable healthcare systems that ensures access to quality healthcare and aim of protecting Filipinos from health risks through the development of a climate resilient and health systems. Maybe I stop there for a while, sir.
Thank you so much. And when you see on the screen, Dr. Mehereen, Director Climate and Health. So Pakistan, Philippines are among the first countries in the LMICs which have a dedicated climate and health focal, director level officers who are working on these themes. And that's where we are heading towards. So in the morning when I was saying to Prashant, a lot of work is happening. We are right now in the project inception stage where climate and health is going to take off. But over to Mehereen for the next 5 minutes. We'll listen to her, what Pakistan is doing.
Where's the, yeah. How do you move this? Can anyone help me with the...
This one.
Okay. Bon dia, everyone. So we have unanimously agreed in the past almost half day that health is an essential ingredient for the social stability and economic virility of the countries. So we all understand the health impacts of climate change. We need to improve the health system's resilience to climate change, but at the same time, as Martin also mentioned in the morning, and Dinesh also, of course, that we need to include a climate lens on the universal health coverage package that every country has. Now, why is climate-informed response key for health system resilience in Pakistan? Now, Pakistan finds itself in a unique arc of vulnerability. We are amongst the top 10 most vulnerable countries to the impacts of climate change, according to the Climate Vulnerability Assessment. And in the past 2 decades, we have witnessed more than 150 plus extreme weather events. So, sorry, that's...
Can we have the slides again, please? I think.
Yeah. I don't know. So press this one. Yeah, so I'll just till the slides come over. Yeah, okay. So just to sum it up, impact of climate change on the health system in Pakistan. Let's just go back a little because there was a slide before this. Sorry, this is just a bit confusing. Yeah. Okay. Pakistan is significantly impacted by climate change. We have increased temperatures. We have glacial melting. We have frequent and severe floodings. The 2022 flood, everybody knows about that. We have droughts and water scarcity. We have sea level rise and coastal erosion, as well as soil erosions and landslides. Okay, now the impacts of climate change on health on the healthcare system in Pakistan are that on the one side it is increasing the demand for the health services, but then at the same time there is a disruption to the access to these health services. So we have increased levels of food insecurity leading to malnutrition. We are among the countries with second highest rates of stunting in the world and fourth amongst wasting, which has already crossed WHO emergency threshold levels. There are changes in the vector-borne diseases. So according to a recent study about in malaria, in 2022 post-floods, the malaria cases changed from 400,000 to 2.7 million cases in a couple of weeks. Dengue in 2025, about 100 million cases of symptomatic cases of dengue are reported, but there are approximately more than 300 million cases of asymptomatic dengue. So you can quickly see, go through the slide. I'm not going to take too much time on this. Now, what are the next steps that we envision for climate resilience in Pakistan? Now, first thing that we believe is strengthening policy and governance, and we need to consolidate and translate the findings that we've done through our climate risk and vulnerability assessments into our national health adaptation plan, which can be showcased at the upcoming COP in Belém. And alongside this, we are working with the Ministry of Finance to update the health financing mechanisms to enable strategic purchasing, create incentives for providers, and improve access to funding for climate and health-related projects. We need to develop region-specific capacity strengthening to build a climate-smart healthcare workforce. Now, we need to completely understand the climate risks. So we need to undertake infrastructure and technology resilience assessments. And we are right now closely working with Asian Development Bank to chalk out a decarbonization framework and see the carbon emissions from our healthcare facilities all across the country. And we are also working on developing integrated data platforms, and we are looking at pathfinders to support us with that. Now, the thing that which has brought all of us together here is to invest immediately to alleviate the key needs. Now, we need to create investment programs, develop integrated solutions for malnutrition and agricultural upgrades, and leverage technology-based solutions to address the worsening conditions. Now, some of the nature-based solutions that are currently we are working on are eco-based ecosystem restorations, green infrastructures in the country, wetland restorations, and protecting and restoring the coastal ecosystems. Now, Pakistan has implemented programs like the 10 billion tsunami program, which is a afforestation program. Recharge Pakistan is a flagship program by the Ministry of Climate Change, which focuses on restoring wetlands and water channels to improve wastewater management, but then in terms address water scarcity problems as well. World Food Programme has advanced multi-year activities under its livelihood and climate resilience work in 3 districts of the country. And these are mostly the ones which were affected by the 2022 floods. Now, in terms of debt swap for health, Pakistan-Italian debt swap agreement has allocated 500 million for agri and health channel through World Food Programme. Now, some of the social protection programs in Pakistan, again, BISP, which is Benazir Income Support Program, is South Asia's largest social safety net program. And we are really proud of it because it's one of the flagship programs in the country. It's conditional cash transfers to 4.6 million women to improve the antenatal coverage and the nutritional status of the women. Again, for us, malnutrition is a very important issue since one of the major drivers of malnutrition is climate change. So we are trying to address that. Pandemic response effectiveness in Pakistan project is 25 million, and it is supporting 5 million vulnerable families through the social protection program. Some of the impact investment initiatives that I'm going to talk about are the Acumen Fund. So there's about 80 million deployable capital, and beneficiaries are around 13.1 million individuals. This is basically through the Green Climate Fund, and it's focused on providing patent capital to agricultural businesses in Pakistan. Then we have Aga Khan Development Network. Through them, there is an Accelerate Prosperity program. It's a global initiative, and it is there to help growth, early stage businesses, startups, and innovation ideas. So they've deployed around 3.22 million USD to impact, to give jobs and support different startups. And some of the major works that this particular organization is doing is providing services for to the hospitals for supporting general checkups and consultations. But again, this is done under the Climate Shield work that the country is doing. Karandas Capital is another organization providing credit and equity-linked direct growth capital financing for sustainable development and climate-friendly projects in the country. Then we have a climate venture fund, Sarmayakar, and this is providing 40 million USD. It's secured from the Green Climate Fund, and this is providing capital investment into Pakistani startups looking into climate and health nexus to help build up the resilience of the climate and health network that Pakistan is doing. So obrigado, and any questions that you want to ask, I'm here.
Thank you so much, Dr. Mehereen. And I think why Pakistan? Because it is showing us a multi-sectoral approach. It's also taking private sector with them when they are talking about climate resilience. Now let me go to two of the youth icons here, not that others are not youth, but Avdesh and Vanshica. While Avdesh works with AIIB presently and was one of the key with Vanshica on the Climate and Health Conclave. So let me first ask Avdesh and then come to Vanshica, because Vanshica, you are going to have a little tougher question on how do we collaborate with AIIB as we move forward. But Avdesh, in your dealing with Government of India, how do you feel the response for climate and health, the appetite for climate and health is developing?
Yeah, sure. So first I'll take you through what's happening in India. So last year in Tamil Nadu, that's a southern state, we had floods. And in the northern state, we had heat wave going on. India is the 7th most vulnerable country to climate change. Almost 5 in every 20 people in India are vulnerable to extreme climate events. And if we see last year, almost 318 days in India were extreme weather events. So 90% population is vulnerable to extreme heat stress as well. And when we talk about the health system is the first responder to climate change. although it is underfunded and understaffed. And when we talk about funding, so in 2022, climate finance accounted for $22 billion in India, but only 4% was given to healthcare. And that is really less. ADB as a bank has been propelling climate and health action in India for long. So during the G20 India presidency, ADB conceptualized Climate and Health Initiative. The Climate and Health Initiative is a platform to streamline and amplify practices and the investment opportunities for the countries and the landscape of climate and health. So it's based out of 5 high-level principles, as Dr. Dinesh already mentioned. But Dr. Dinesh, as we go to a lot of policy advocacy events these days with the government of India, and we have seen what they say. So now, right now, the prerogative is, we know that climate is impacting health in India, but what are the solutions to it? So the government officials have started asking us this. We had a climate and health solutions conclave in India recently, where we brought together the bureaucrats, the policy makers, the innovators, and the private sector under one roof for 2 days, where we pondered upon what are the major priorities for climate and health and what are the innovations that we can implement. And we had like 9 priority areas, which are heat, early warning system, vector-borne diseases, NCDs, human resource for health, finance, infrastructure, and digital health. And Vanshica was like a part of it as well. Right now, we are working on an outcome report that will be a ready reckoner investment book for the states, and of course, it can be used for other DMCs as well, which will have curated, locally relevant interventions which can be implemented by the governments to tackle climate change and health. Presently, also, we are in talks with Telangana, Andhra Pradesh, different states of India which are very vulnerable to climate change and health, and we are trying to mainstream the interventions to climate and health. Thank you.
Well, thank you so much. I think the point to take here is that governments do want solutions. So what Jay and Nishant showed us were they were ready with the solutions. The government had the appetite, and this is how the financing dovetailed. So for me, financing is secondary. The ideas are number one. And this takes me to Vanshika, who recently convened the Bellagio financing for convening on heat for ADB. She worked with ADB, but now she's a full-time staff of AIIB. So Vanshika, over to you. How AIIB and ADB can collaborate on climate and health. In the morning, we had Tamir from World Bank who spoke about how ADB and AIIB can work, World Bank can work together. Perhaps we can listen from you. What are the strategies of AIIB in the climate and health space? Over to you. Thank you.
So firstly, very good morning to everyone, and it's such a pleasure to join this panel. Very excited to be here, so thank you for having me. And it's I think so inspiring to see that that the area of the climate health intersection has come so far from the time that I think a lot of us here have collectively worked on high-level agenda setting to now seeing that the ecosystem has reached a level of maturity where we are talking about what would those interventions be and what would the projects be. So I'll talk about potential areas in terms of collaboration between the MDBs and what particularly AIIB as a young bank is looking to do in this area. So just for context, for those who would like to know, may not know much about or want some more details on AIIB. So the Asian Infrastructure Investment Bank is very uniquely positioned because it's the world's youngest MDB, set up in 2016, and it's celebrating its 10th anniversary this year. The last such multilateral institution was set up 23 years back. So therefore, as a young growth stage MDB, this gives a unique opportunity where the bank has less legacy issues, is building new pipelines, has the appetite for new emerging areas, and is a bank that's Asia focused, but has 110 member countries. It has the second largest number of member countries after the World Bank. So it has a huge footprint. So I think all of this makes it very uniquely positioned. And as well as that, the fact that it's headquartered out of Beijing, China, which itself is a great example of several climate health challenges that at a national level they have kind of turned around, be it air pollution, be it their work around nature-based solutions, and so on. I think when I think of scope for multilateral collaboration between ADB and AIIB, I think the first few things that come to mind are, ADB, of course, as a legacy embassy. A legacy MBB does such substantial and kind of unparalleled work, which lays the ground for so much policy advocacy and upstream work. And I think that's something that AIIB is moving towards, has started moving towards, but is still a new player there. And most of our focus has purely been on projects and more conventional sectors such as transport, energy, urban, water, health is coming up in a big way. But I think that synthesis of bringing upstream and downstream comparative advantages of both the banks together has a lot of potential. I think the second is both countries together would unlock the country basket that could be catered to. The 70 countries, 69 countries of ADB and 110 member countries of AIIB, which are across even Latin America, Sub-Saharan Africa, and so on. And then third, in terms of working on new products and new kind of possibilities. So those are few points that come immediately to mind. But just to build more on that, provide more context, at AIIB, the way the bank is framing the climate health intersection is through the lens of planetary health. And the bank feels that as we talk about climate and health, why should nature be an afterthought? So in February this year, we had the Planetary Health Infrastructure for Planetary Health report that was launched by the bank, which looks at four major specific takeaways. Firstly, unlocking core benefits of climate health nature. Secondly, viewing healthcare as infrastructure, or rather health in infrastructure across all projects. Thirdly, viewing nature as infrastructure and infrastructure as nature. So these are some of the key points that it's come out with, and trying to embed that philosophy among the operational teams at the bank. Around this, we're exploring, can we potentially establish a planetary health platform that can help support more upstream work of projects,